Reproductive health care. Let's talk about family planning. When a couple or a person is planning pregnancy, this helps give control over the number of children that they decide to have. It helps determine when and how far apart those children are born, and when reproduction will stop or how they are going to avoid unwanted pregnancies. Preconception care should occur at least 3 months prior to conceiving. And it helps determine the outcome of a pregnancy. It also helps prevent fetal or maternal complications. Women often don't realize they're pregnant during that early stage of pregnancy, and often that's when the damage to the fetus can occur. It's important for women to eat healthy, be active, take those daily folic acid supplements, protect against sexually transmitted infections and other infections, avoid harmful chemicals, metal or other toxic substances, be up to date on all vaccinations, manage and reduce stress, stop smoking, stop using street drugs and certain prescription medications, reduce alcohol intake before and then quit after becoming pregnant, stop partner violence, manage any pre-existing health conditions, learn about your family's health history, and get regular checkups. Again, this all should occur about 3 months prior to actually conceiving. There's different methods of preventing pregnancy. We have natural methods. And of course, abstinence, which is refraining from sexual intercourse, is the only 100% method of preventing not only pregnancy, but sexually transmitted infections. Coitus interruptus, or removal of the penis from the vagina prior to ejaculation, is a form of birth control, but it's pretty unreliable because any pre-ejaculate fluid, even one drop, can contain sperm and semen at the vaginal opening, and this can cause pregnancy, and it does not prevent any STIs. Lactational amenorrhea. This is a method of birth control after a woman has had a delivery of a fetus and is breastfeeding. If she breastfeeds every 2 to 3 hours consistently without fail, night and day, then it can be an effective method of birth control. But understand, every 2 to 3 hours is pretty time consuming and pretty intensive, so it really is not the best reliable method of birth control. Fertility awareness methods, also known as the rhythm method, and involves all methods that are used to determine a woman's fertile and infertile phases of the menstrual cycle. It also involves that calendar method, the basal body temperature method, the cervical mucus method, the symptothermal method, standard days method, and ovulation predictor test. It does require the use of abstinence or barriers to prevent pregnancy during the fertile periods. And then we have the barrier methods. This can include spermicidal agents, condoms for men, condoms for women, a diaphragm, and a cervical cap. We have hormonal methods, which includes the oral contraceptive pills, the progestin-only pills, hormonal injections or implants, a transdermal patch, and the vaginal ring. The intrauterine device, or the IUD, is a non-hormonal copper device that is inserted into the uterus and also can come with progestin. Sterilization. In the woman, this would be a tubal ligation or occlusion. It requires a regional or general anesthesia to complete and has to be done in the operating room in a surgical facility. In men, a vasectomy. This can be performed only with local anesthesia in an outpatient setting. In other words, it can be done in the doctor's office. But it's important to understand that it can take up to 1 month for remaining sperm to be eliminated from the system. So it's important for the male to use other birth control methods until a negative sperm count verifies sterility. For example, a very good friend of mine, he had a vasectomy. They did not want children, and she is now pregnant. It was a failed vasectomy. So these are both surgical procedures and they should be considered permanent, although there are some procedures that might be reversible. And then we have emergency contraception. This is an oral medication and it should be used as soon as possible to improve the effectiveness, usually within 72 hours. An IUD can be used up to 5 days following an unprotected intercourse. So, of the natural methods used to prevent pregnancy, what is one method of predicting the fertile window? This is the symptothermal method. We talk about sexually transmitted infections in nursing care of the adult, so we're not going to go into a lot of detail here, but you still need to be familiar with them. Incidences of STIs are higher in adolescents than any other age group. Infants that are affected with STIs usually are infected either prenatally or during the birthing process. Children that are infected after the neonatal period have to be considered victims of sexual abuse until that has been disproved. Severe or repeated episodes of PID or pelvic inflammatory disease or severe genital warts are indicators that the client should be tested for HIV. Prevention is the most effective tool against STIs, and the only way to avoid them is sexual abstinence. Condoms do provide protection, but they are not fail-safe. Adolescents have to be taught all aspects of the consequences of not using appropriate protection. Excuse me. So we have the human papillomavirus, or HPV. This is the most common STI in adolescents. It does include many related viruses in these categories. Sometimes it can be asymptomatic and go away on its own, but sometimes it can cause genital warts or cervical cancer or other issues in the male client. It is recommended that all males and females be immunized by the age 11 or 12 to help prevent HPV. Gonorrhea is one of the most commonly reported STIs in the United States. It often goes undetected in the female until it progresses to pretty serious pelvic disorders. And in the male, it can cause sterility. We treat it with a variety of antibiotics, and it's important for us to know the names of sexual contacts because they also have to be treated. There is no immunity to the gonorrhea organism. You can become infected again if you're not careful. With chlamydia, it has replaced gonorrhea as the most common and fastest spreading bacterial STI in the United States. Symptoms can be mild or asymptomatic, and a delay in treatment occurs until serious complications or transmission to others has occurred in a lot of these cases. It can result in PID, which is a common result of chlamydia. It can cause sterility, and it can also lead to tubal pregnancies. Antibiotics are required to treat this disease. Genital herpes is epidemic in the United States. It starts as a vesicle that ruptures to form a painful ulcer on the genitalia. It can last 10 to 12 days, and recurrent episodes will occur intermittently. This is not something that you are ever going to get rid of, so there's no cure. Acyclovir is a medication that can be used to relieve or suppress these symptoms. It is an antiviral. If women have genital herpes, they are at a high risk for cervical cancer. This is a disease that is not transmitted through the placenta, but if the mother has active lesions at birth, cesarean birth is required. Syphilis is a destructive disease that involves the entire body. It can have devastating long-term effects if it's not treated. And infected mothers are likely to transmit this to their newborns. Excuse me. It is spread primarily by sexual contact. The symptoms in the primary stage will usually appear about 3 weeks after exposure, but there's also a secondary stage, a latent stage, and a tertiary stage. The cardinal sign of the primary stage is a canker, or a little ulcer that appears on the penis, the vulva, or the cervix, but depending on the sexual contact, can also appear on the mouth, the lips, or the rectal area. In the secondary stage, we begin to see a rash or sore throat, a fever. The latent period can persist for 20 years without symptoms, but it does damage in the body. With the tertiary stage, and again, these are without treatment, we see severe neurological or cardiovascular damage, including mental illness and GI disorders. We treat it with an injection of penicillin, and if treatment is not obtained before that tertiary stage, those complications can lead to death. Then we have HIV. This is that acquired, it can cause the AIDS, or the acquired immunodeficiency syndrome. With HIV, it will replicate and attack and destroy our natural T4 helper cells. It's important for our immune response, or those T helper cells are important for the immune response. And if HIV begins to replicate, then opportunistic infections can occur. Transmission of HIV comes through sharing of infected needles, exposure to infected body secretions through sexual contact, or an HIV-positive woman to the unborn fetus or newborn, usually through the placenta. And if the birth process is contaminated with the mother's blood or through the breast milk. There is an incubation period of 3 to 12 years in some instances. These manifestations, infants and children are often asymptomatic, but we may see a failure to thrive, the oral candidiasis, chronic diarrhea, developmental delays. Flu-like symptoms, fever, rash, sore throat, enlarged spleen, lymphadenopathy, recurrent bacterial infections, lowering CD4 cell counts, excuse me, pneumonia, the wasting syndrome, HIV, encephalopathy, and cytomegalovirus can all occur in other individuals, the adults. Treatment, we do that highly active antiviral drug therapy, also known as HART. Again, this does not cure, but it can greatly decrease the incidence of opportunistic infections. So true or false? A young woman who is HIV/AIDS positive delivers a child and wants to breastfeed. As with all new mothers, breastfeeding should be encouraged. This is false. We can transmit the disease through breast milk.